So I was admitted a few days before my scheduled knee surgery after a fall. At the time, I was told that a knee arthroscopy was needed, and the doctor gave me some instructions on things I should do to help with my recovery. After surgery, I vaguely remembered someone, I cannot remember who, told me that a different surgery was needed, but that was as far as I could remember. I think they came in while I was still tired, so I can't really recall everything. Then a few days later, someone told me that I could leave. And before my discharge, I specifically asked the nurse, was there anything I need to watch out for? And she said that I was free to leave and I had everything I needed. When I went back for my follow-up appointment with my surgeon, that's when I found out that my knee injury was more severe than previously thought. And they had decided that I needed a different surgery and with a different discharge instructions, which I was completely unaware of. So from my perspective, I did everything I was told to do, but my knee just kept getting worse.
This is what we'd call an adverse event or an injury caused by medical management rather than the underlying disease that prolonged hospitalization, produced a disability at the time of discharge, or both. In this case, because of the failure to communicate the correct discharge instructions, the patient was unaware of the updated instructions and did not follow an appropriate recovery plan after returning home. As a result, there was improper care of his knee and he experienced severe knee pain at follow-up.
From my perspective, the biggest signals that this was an adverse event was pretty much that written instructions weren't provided to the patient at any point during his discharge, and that the patient was told instructions when he was incoherent. And that's not the best state to give instructions to a patient to.
So what do you think was the main reason this situation arose?
Due to the lack of communication between the team members, as well as communication with the patient and the family members, the patient was sent home with the wrong discharge instructions. Although the surgeon stated to the patient the procedure was more severe and new discharge instructions would be provided, he gave this information while the patient was recovering in the PACU, and the patient was incapable of comprehending this information. This adverse event was not the fault of just one team member, it was a breakdown in the system as a whole. There were many opportunities for each member to stop the patient from leaving the hospital with the incorrect and unsafe discharge plans.
What could you personally improve on in the future to prevent this from happening?
So I want to start using the teach-back method more often, and this is something where I ask the patient to explain back to me what I just told them, and that way I can gauge their understanding of the information I just provided. I definitely want to provide written instructions, and since the patient is receiving multiple instructions in a whirlwind surgical process, possibly dating the instructions and using email would help solidify the transfer of this information. And this way the patient knows the exact information and when it was given so that everything can be kept straight chronologically. I also want to involve family members and inform them of the post-op instructions so that they can help the patient adhere to these instructions. And so basically I guess what I'm saying is we need to communicate more efficiently. And in cases like this in the future, I not only want to provide a verbal explanation of my reassessment and altered plan of care, but I also want to provide it in a consolidated written form.
All I have documented for this patient that day is that I got him up and out of bed, performed gait training, and we reviewed the discharge plan. I assumed the patient already had written instructions, and I did not check to make sure that he did prior to leaving. In the future, I would provide written instructions regardless of whether the patient had a copy or not already. I'd also check to make sure the discharge plan makes sense with what procedures were performed and converse with the referring surgeon if something was amiss. I should have been more attentive to details. I'm really sorry for what occurred as a result of what I didn't do.
Yeah, you look like really upset about what you're disappointed.
Yeah, I mean they should have told us. They should have just told us when they realized that there was a mistake. They should have told us whether it was a day later or a week later. Either way, we would have been able to adjust what we were doing sooner and not continue the wrong thing. You know, what if the mistake was more serious, like one pill a day instead of one pill per hour. And what would they have done then? Would they have told us, or would they have just waited till we came back to the hospital with an overdose?
What did the hospital do following the error?
They put us in touch with a social worker to help us understand the circumstances around the error. Physical therapy helped us out, altered the plan of care, and taught us new exercises. This helped us understand that the error wasn't the fault of any one person. We just happened to fall through a crack in the system, which is unfortunate, but at least it draws attention to it, and something can now be done to fix it, so that doesn't happen again with worse outcome, worse circumstances.